Hello, everyone, and welcome to today's webinar. My name is Paul Ihekweazu, and I'm the Community Manager for the ICFJ Global Health Crisis Reporting Forum. Since the outset of the pandemic, we've been intentional about guiding journalists from across the world to improve their skills and to expand their body of knowledge, and also let them be aware of issues that they may not be aware of that could be very, very relevant to how they report and the kinds of stories that they also cover. And when I joined the ICFJ in this capacity, the first webinar I did was on solutions. I hosted was on solutions journalism. And the reason why this is important is because it has been, I've found that reporting health issues, reporting global pandemic from the disease perspective could actually become depressing and unable to, viewers and audience may not be able to see the whole picture. And it was also relevant, it was obvious through the participation of journalists in that particular session that is something that everybody, most of the audience would also love to do. And so which means we now have to take it from looking at it from a singular story to how this affects a media organization and how an ecosystem or how a journalism project can be built around solutions journalism. And one of the successful models out there is a story of Nigeria Health Watch, which is always about talking about the interventions. And this approach has been lauded both locally and internationally. And this is why we have Vivianne Ihekweazu with us today. Vivianne Ihekweazu is the Managing Director of Nigeria Health Watch. Nigeria Health Watch is a health communication and advocacy organization that is based in Nigeria. The organization is advocating for improved access to health services, and she's responsible for designing and implementing health communication and advocacy strategies and campaigns for government, not-for-profits, and development partners in Nigeria. Our work currently focuses on nutrition, maternal, newborn and child health, routine immunization, sexual and reproductive health and rights, and epidemic preparedness and response. She played a leading role in the COVID-19 crisis and emergency risk communications team, supporting the Nigeria Center for Disease Control in public health communications, in determining messaging priorities and developing public health guidelines. Vivianne holds a BA Honors in Economics and Business Administration and received a MSc in Development Economics from the University of Sussex and an MBA from the Gordon Institute of Business Science in the University of Pretoria. She's currently an African Public Health Leaders Fellow at the Center for Universal Health, Chatham House. And I would like to say thank you for joining us, Vivianne. How are you doing today?
Hello, Paul. Fine, thank you. Good to be here. Thank you for inviting me.
Yeah, that was a really, really impressive and humbling profile that you have there. And from somebody that really knows you, I also know that that is actually a conservative profile. So I'm really glad that you are able to join us today. And if you're hearing anything from the background, that is a short video that we would like you to see before we start this conversation. We'll watch the video first and we now go fully into the dialogue.
How did Nigeria Health Watch constructively report the COVID-19 pandemic?
Vivianne, is the sound working? Can you hear it?
Yeah, right.
So I'll go right back, get it on full screen.
How did Nigeria Health Watch constructively report the COVID-19 pandemic? The COVID-19
Paul, the sound doesn't seem to be working. Paul, the sound doesn't seem to be working.
Yeah, are you hearing it?
The sound doesn't seem to be working. It's possible to restart it. It's not a long video. It's only about 3 minutes.
Okay, let me see. This has to work. It must work.
Share.
Share.
Effect from 11 p.m. on Monday, 30th March 2020.
2 days later, Nigeria Health Watch published its first photo story taking Nigerian in the National Reference Laboratory. For the first time, Nigerians were able to see and connect with the health workers at the forefront of the pandemic, showing the COVID-19 sample testing process. In addition, we were able to show visually active case findings were scaled up in a community in Abuja. A key challenge identified at the onset of the pandemic was convincing Nigerians that COVID-19 was real. There was also the challenge of stigma. So people were reluctant to share that they had tested positive to COVID-19 and survived. Nigeria Health Watch shared the story of a survivor of COVID-19 who had spent time in an isolation center. We were also able to report a community-led relief efforts, showing how individuals, communities, and businesses were provided hope. We showed how big businesses came together, and we constructively reported how challenges like shortages in PPE and other hospital equipment was addressed. Communications was a critical part of the COVID-19 response as it enabled people to be informed and it empowered individuals and communities. Our reporting helped to show the importance of communication channels that were being used to build trust in the response. Despite predictions of the worst outcomes for African countries, Nigeria Health Watch used different voices to report constructively how Nigeria responded to the COVID-19 pandemic.
So that was quite lovely to watch, and I think it brings into perspective the key issues today. And so let's start from where the video stopped. Why was it important for Nigeria Health Welfare Organization to prioritize the approach it took regarding its COVID-19 coverage instead of what many news outlets was doing, giving us the numbers of people that have died, the number of people that have tested positive, and other aspects of COVID-19 reporting? Why was that approach quite critical and important for your organization?
Okay, thank you very much for that, Paul. I think I'll start off by telling the delegates who Nigeria Health Watch is. Nigeria Health Watch, we are a health communications and advocacy organization based in Abuja, as Paul mentioned in the intro. The work we do very much is geared around working with the government of Nigeria. We're an NGO, so we work with, not for, to actively engage and support the Nigeria government in disseminating information and increasing awareness and knowledge about health issues. And also our advocacy really is geared towards holding duty bearers to account and ensure that they deliver on good health care and stick to their promise, and ultimately also to ensure that we have a well-funded health system. So you mentioned about our use of solutions journalism. We really are an organization that uses different tools as part of our advocacy, and doing solutions-oriented reporting has been a critical part of that. Why is this? Because in Nigeria, we look at how traditional journalism is is structured. So, if you say, what is the definition of journalism? Journalism is the active gathering of news information and presenting the news information to people. So that's the normal model of what journalism is. And why do we even do journalism? What's the purpose of journalism in the first place? We use journalism really to provide citizens with information they need to make good decisions about their lives, communities, and societies. So one step further, why solutions journalism then? Using the explanation or definition from the Solutions Journalism Network, solution journalism is a spread and practice of solutions, in a rigorous and compelling way. And ultimately, the critical word here is showing responses to social problems. So it's not just about the traditional, gathering information, assessing and presenting the news. This is more one step further about presenting solutions to social problems. And ultimately, when we had the COVID-19 pandemic as an organization, we had to very, very quickly adapt the work we do, but remembering that the use of solutions journalism in that context at that time was different from most news organizations, in that people at that point were just reporting news, many of it alarmist. But we found avenues, as you saw in that video, to also report on how communities, businesses, individuals were finding solutions to cope with the overwhelming challenge that we all faced. So at that point, as an example of the work we did, we adopted and used a solutions-oriented lens to report on the news rather than going with the mainstream methodology of just journalism, which is just reporting and gathering information and presenting it to people to decipher themselves.
Okay, yeah, I do agree with you. And I think one of the things that usually many journalists, some journalists that I discussed with leading up to today's conversation raised was that if one of the concerns they believe the media organization would have to deploy a similar approach, would the general public seeing them as intentionally turning a blind eye to the negative aspects of the news. So how do you convince individuals that the positive side of the news is enough to focus on without being considered as a biased outlet?
I think that's a very interesting question, because ultimately it's almost like asking, are we not just presenting the positives when we're reporting the news? If you think about it, we always say that bad news sells. So the default is, when you're listening to the news, when you hear negative news, it's almost like that's what resonates often with people. But the flip side is, often in societies and communities, people are actually finding solutions to problems they face. And this was really the genesis of how we as an organization came into using solutions journalism. The whole idea of solutions journalism started probably around early 2010, 2012, 2013. Prior to that, in many European countries, there is another similar, it's the same thing really, called constructive journalism. So in the US, it's more, it's called solutions journalism. And the whole premise of it is very much on reporting on, news and that sort of thing. However, early in about 2013 or so, as an organization, we were already producing editorial, more opinion-focused pieces. But we also wanted to ensure that there was a realization that, in the health sector, we are faced with so many challenges, and nobody is talking about how programs are working, what difference they're making, how they're solving challenges that even the governments themselves are not able to solve. So we're using a solutions-oriented reporting lens. What we started very slowly doing, and at that early stage, I wouldn't say that the whole landscape of solutions journalism was as formalized. However, what we made sure that we did is we looked at interventions that were making a difference. So responses to problems. How was those responses to problems being met? Who was responding? Individuals, communities, businesses. And then, you provide evidence of the response. How effective has it been? I.e., what difference has it made? So this is often also data-led. So it's not just, and the data is quantitative or qualitative. It's not just reporting, this was fantastic, this was brilliant, but gaining insights into how the communities and businesses were responding to that particular problem. But the critical thing at the very end is it's not just about saying this is a wonderful, perfect solution. There are also limitations within any solution that's implemented. So within that solution that's implemented, is it something that is sustainable? Because it's very easy to come up and have a solution that can work for 2-3 months. But then if you're looking for something sustainable, you're looking for something more long-term. Is it a solution that can affect the community or just the community, or could it be something that can be scaled up and applied to different states? So, we also apply a critical lens in the solutions-oriented reporting by ensuring that these are things that we cover, and we're not just almost doing like, PR and promoting a particular program at all.
Yes, my mic was up. So one of the, I think personally, something I really find quite exciting, I think is the organization that does it much more effectively for me than several other subscriptions that I have, is the newsletter. And so when I'm trying to share my screen. So if somebody receives, this is just a copy of the newsletter that the one I could quickly access to. As you can see, so there is this, you can actually put phases to the issues, and it's quite different from how we used to envision newsletters. You can actually see approaches. For instance, this kind of story is not just, you can see that the journalist is not just sitting in the office, but actually going to places that are quite far. We also see elements of integration, of visualization, and it's most of the time you're able to actually read the complete piece even within the newsletter without having to visit the website. So was this decision intentional? Because normally somebody would expect that you will be using the newsletter to drive traffic to the website. But from from my email, I can read the complete story, and that goes about it. So what was the rationale behind taking that decision? And does it make a business sense for media organizations that are always prioritizing just putting a snip of the piece in the newsletter and redirecting them to the main page for the full gist?
Okay, no, I think the very premise behind our reporting, as I mentioned, using the solutions-oriented piece is to find solutions to challenges in communities. And ultimately, who are those for? The beneficiaries of those are twofold. A, is for the actual communities themselves in different parts of the country, to see how people within communities are rising up and finding solutions to problems they have. But at the same time, I mentioned the word advocacy organization. So the very critical part of the advocacy part is actually showing how individuals and communities are finding solutions to problems in a bid to hold government to account. Hold government to account in the sense saying, look, this is working in this community. The community is rising up and taking their own health situation. What is the government's responsibility to ensure that they also support, be it in scaling of interventions or solving the problem that the community themselves are solving? I'll give you an example. We reported on a story in Jigawa, I think it must have been 2019, on how pregnant women were using their social grants to fund a taxi. Now, why were they doing this? If you understand one of the leading causes of maternal mortality, it's in the many factors, but they're what we call the 3 delays, which leads to maternal mortality. The first delay is when a woman is in labor, does she identify she needs to go to hospital then? The second delay is actually getting to the health facility. And the third delay is treatment in the facility. And the second delay, which is transportation, is often also a leading cause of maternal mortality, because if a woman is in labor and she's in distress and she cannot get to her facility, then her and her baby are at risk of dying, which is why in this community in Jigawa, they took matters into their own hands and used their grants to purchase a taxi. Whilst that was a good thing, obviously it probably saved lives of the mother and the baby. At the same time, the grants that they were given, it wasn't a lot of money. It's for them to use to support their families, which they're now channeling to the use of this taxi. So yes, whilst it might have been applauded as an intervention, which it did solve a problem, however, the responsibility of the government to provide healthcare has been abdicated. So that also was used to hold the government to account. Because even though they buy that vehicle, they have to fund it with petrol, they have to make sure it's maintained. So yes, it was a solution. The limitation has to be the sustainability of it. And that is where we hold government to account.
Yes, so I forgot to say this. So if you are watching live on the Zoom platform and you have any question for Vivianne, use the Q&A option on the Zoom platform. And if you are watching on the Facebook via the Facebook live stream and you have any question that you would like us to that would like me to table to Vivianne, please don't hesitate to use the comment box below the video that you are watching. And so talking about running a major organization that has become well known for solution stories, let's take your mind back to how it all started, and so that we can be able to guide individuals and organizations that are adhering running a similar approach. So what advice can you give, and what vacuum do you still think is still available for new ideas, new media ideas to fill?
Okay, our journey in solutions journalism was, I wouldn't say we started off with the view to do solutions journalism. We very much started as an organization to make health news a lot more accessible to Nigerians. At the time, and this was in early 2010, 2011 or so, there was a dearth of reporting that held government to account in the health sector. So ultimately, journalism and health reporting followed the standard approach of gathering information and just presenting it to people, and that was it. But there wasn't that angle of holding government to account. So really our journalism at that time really started by, holding the government to account to deliver on the health promises to Nigerians. And then it sort of expanded into the realization that in doing so also, there was a need to provide news stories that showed how programs, individuals, community societies were responding to some of those problems. And that's how our journey with solutions journalism really started. Now, as you know, with journalism, there's always a funding problem. And news reporting on health is not the most exciting. If you pick up your newspaper, I think it's changed a lot in the last 5-10 years. Traditionally, things that sell newspapers are entertainment, music, sports. That's what sells newspapers. Health news is not exciting. And so for that reason, there's a vacuum in information to people about news. And also not just a vacuum, but presenting it in an accessible way. So, which makes funding health journalism not very profitable. So we were fortunate enough to have been identified by an organization that was very keen on ensuring that health news was included in the news cycle, and that more of health news was reported. So our model is we're an NGO, so our writing and our editorial is very much grant funded. And I think there's a similar thing in many other countries across the world whereby development stories ultimately are grant funded, simply because as a profit model, as a standalone, it's not profitable for people to just focus on it. But I do know within that, having said that, in the last few years, I've noticed a lot more organizations that have paywalls in reporting their news. So you have, as you mentioned before, you have a small piece of the news, and if you want to read more, then you go behind the paywall. But given the fact that we are grant funded, the aim is to make the news, the health news we report on, accessible. So we of course are funded to go and investigate on the stories, solutions-oriented stories, with a view to ultimately find solutions at the end of the day to health challenges.
Yeah, so you actually mentioned something that I think is quite double-sided, as in two-sided. For instance, for organizations that want to do a similar approach for what they are doing, there can be a media organization that is launch, that can set aside like a solutions journalism focus project, just like the Touchlight series, and organizations that are also focused on key issues can also have an initiative that prioritizes solutions journalism by reporting the stories around what they do. So how do you, considering the grant funded, the grants that organizations have provided you with, where do you draw the line to ensure that these organizations are able to know that even though they are funding this reporting project, you are still able to maintain that journalistic independence in your reporting?
I think, you know, the assumption and the reason why we work with partners is, I think we've developed a reputation as a trusted source of information. And as I mentioned, editorial integrity is central to every single thing that we do. So when we report on health interventions, we are very conscious of not just presenting it as a PR piece. And, you know, it does take a bit of, you know, insight and digging to ensure that the intervention is making a difference in the community, so that the information we gather in terms of evidence is often quantitative and qualitative. Qualitative in terms of talking to recipients of the intervention, because they are the ones who ultimately will say whether it's made a difference in their lives or it's not. And adding on to that, the focus of this discussions webinar is how to make solution journalism a part of news outlets' DNA. You can imagine Nigeria Health Watch, in an island in a sea of print journalists, just doing our own solutions journalism. And what you don't want it to become is like a niche way of reporting on news. So we were very fortunate enough to be partnering with Solutions Journalism Network. So we're now actually training mainstream newspaper outlets, so it's not just newspaper, media houses, in instituting the practice of solutions journalism within their media houses. So over the next almost 3 years, we aim to train at least 30 media houses in the practice of solutions journalism. We've started with our first 10 cohort of news houses, and that started early this year. So the mixture is print, the mainstream, and then some online news outlets, TV and radio. And the aim is really to institute this practice of solutions journalism within mainstream media houses, so that it's not just them reporting on news or journalism in the traditional sense, but also looking at solutions and getting their journalists, training them also to be able to identify where communities, individuals, businesses, etc., are responding to social problems, not just in the health sector, actually. And the aim is to hopefully expand this so that we get a lot more reporting whereby we are finding solutions to our problems. We're very good at identifying problems. It's very easy to do often. But how do we think of solutions ourselves to problems? So when we see examples where that is being done, I think it's also important to report on those, not just focusing on everyday problems.
Yeah, and I think you actually went into one of the questions that we have for you, which is the person says, I lead a newsroom and would like my journalists to write more on solutions journalism stories, but I don't have a background in solutions journalism. So what are the best tips do you think I can have so that I can be able to pass this message and get them writing solution stories? So for those that are not able to access your kind of training, and how do you think they can still start that journey of convincing, of changing the approach of journalists in a newsroom towards doing more solutions journalism, not just as an instruction from the editor, but something that they are wholeheartedly and fully committed to doing?
I think thank you for that question. I think there's that word you mentioned, which is a commitment to respond to important problems. And you mentioned, how can you access the training if you are not able to first get it through an organization like Nigeria Health Watch? What I would say is, there are online resources, of course, that one can use. But, if you on your own wanted to report on a solutions-oriented piece, they're almost like 4 pillars or 4 tenets that you have to look at when you're finding or reporting on a news item. For instance, what are you reporting on? Are you reporting to a response? If you find you're reporting to a response to a problem, that's the first thing you have to think when you're thinking of reporting on a news. So, for instance, you go into a community, there is a cholera outbreak, let's say, for example. I mean, not sounding so negative and graphic, but suppose there's a cholera outbreak within that community, and there's no intervention that is evidently there. Are there examples of people who within that community, despite not having outside resources, etc., are actively responding to that problem? And if they are, what evidence do you have that that's intervention or solution is making any difference? Are people actually speaking and saying, yes, we did X, Y, Z, and this organization or individual group of people supported, is it making a difference? Are there numbers in terms of maybe lives saved or people who are prevented from getting ill? And you gain insights to the actual community, how they themselves have seen the best way to respond to the problem. And within that solution that you've actually found, is it a scalable solution? Is it a solution that's sustainable? Is it a solution that needs funding? Is it a solution that needs training? Or what other resources would be needed? So often we are quick to identify problems, but if within situations we can find people or whoever is finding solutions to problems, I think that's from the starting point is your angle in deciding on how you will report on a news item, whether you're going to just provide information or are you going to try to see how what you're reporting can explain how a problem can be solved.
Yes, so there's also another question on how do you think, what's your suggestion for how media organizations should categorize solution stories? Do you think it should be categorized as a section? Is it okay to categorize as a section in their newspaper? So what are your thoughts on this?
I think that's an interesting one because, as I mentioned, when we first started off, we were almost like an island within a sea of the normal mainstream journalism. And what I think want to guard against is it's been seen as a niche way of reporting news. I do think it's something that's going to or has picked up steam significantly since we as an organization first started reporting solutions-oriented news items. We see a lot more interest, even within the media houses that we're training. At least two or three of them have already said that they want to set up a solutions journalism desk. So to your question of whether it's a separate section, I sense at this stage that there may be a view to almost like have it as a separate section, given that if they say they're going to set up a desk, which means they're going to have dedicated reporters kind of reporting more solutions-oriented pieces. I think it would be great to get to a stage whereby in the midst of reporting, not just health, but education, infrastructure, business, whatever it is, you see solutions-oriented pieces integrated within the main news stories. But I think at this early stage, I sense the media houses still see it as early days and something a bit separate to the standard way that they reporting on news.
Okay, so I also got another question regarding the attitude and of even the reader, the audience to solutions journalism stories. And do they, from what you have at the back end at the organization, do solution stories equally excite or attract readers the same way as other stories do?
I think we still are in that realm whereby bad news sells, not bad news, but people have an accepted view on news, which is not always positive. In that sometimes you hear people saying, "Oh, I can't watch the news, it's all negative." So very much so when we do our solution-oriented piece, what we do see sometimes when people read it, they leave comments, which shows that they're impressed, they're surprised, that solutions have been found, and there's interest. So I think at this stage, what, if anything, there's interest in solutions, and there is a desire on, for instance, development partners to also read some of these articles, because they too, are looking for solutions to the different challenges in the countries where they work. So for them also, reading the solutions pieces is very informative. I'll give an example. We did a story in Kano about 3 years ago on how there was a scheme to train, community midwives. I mentioned maternal health being a big challenge in communities. So they were almost like training these lay young girls to provide healthcare advice and services within the community in Kano State. And the girls go through basic 12 to 24-month program in providing this community support to mothers. And then one of the largest partners that we work with has now put in place a similar program in Borno State, also using lay community workers or community midwives in that sense, to provide advice to mothers and also advice on sexual reproductive health services like family planning. So the reporting and reporting on solutions-oriented pieces is also a way for the government also, but also for different funders to see how they could maybe use some of these to scale up or to implement solutions in communities, and maybe they take some of those solutions and adapt or find ways to make them more scalable and sustainable or improve on them. So, the audience is twofold, but I will say that the main news items you still see remain the standard, this is happening, X number of people are dying, just literally reporting the facts. So, yeah.
Okay, I think so. There is a question, Irene, that I think you've mentioned the part of it, but I think if you can help Irene spell it out, it will be cool. So Irene, I think is an independent journalist from Cameroon, and I would like to know what are some revenue streams that could work for a solutions journalism model, and based on your experience of Nigeria at Watch.
I think in terms of revenue streams for solutions journalism, the thing about solutions journalism, you're often reporting on interventions, within communities. So of course, there's the standard funding that you need in terms of transportation, travel, accommodation to investigate those stories, which really is where the cost comes in place. In finding revenue models, I know many different organizations have tried many different items. One of them is having some of the news stories available for free, and then they have others, and larger structures like Economist, etc., and Guardian in the UK use this model, whereby they'll give you X number of stories a month free, and then if you want to read more, then there's a paywall behind them, and that is a much used funding structure for many news houses. And enable for you to be able to do that, you have to be at the baseline producing very, very engaging content that if somebody has access to just 3 news stories a month, once they've exhausted that 3 and they want more, they now have to pay for it. And that comes really from ensuring that you produce engaging quality editorial.
Okay, yes, still on the model. This week, I think I'm also attending a virtual conference in, I think, News Rewired, and it was one of the stuff that they raised at that conversation. And I think the reason why it's relevant is this: they also talked about, beyond just the paywall, building a community for around your audience, so that they become part and parcel of what you do at your media house, Colette. And when the time comes that they really need to start paying, it's much easier for you to actually speak to them, encourage them, and tell them why they need to start paying for the news. Because over the years, I think journalism has been known to be giving news out for free. Sometimes you ask audience to pay for the same thing that you print, to pay for the news that you publish for free online. I think it has been a systemic model. So the question I'd like you to ask is this: how do you engage with the audience so that they have a more sense of belonging just beyond clicking the story and moving on? Do you have any suggestion around creating an audience, an ecosystem, or yeah?
That word community is important, because when you build a community, the community now becomes trusted, and the community now becomes loyal to your reporting. And in Nigeria, I think, we have our subscribers that receive our information on a weekly, they receive our editorial on a weekly basis. And many of them you see often leave comments when they read a news item. But also in terms of building community and integrating as kind of a call to action in the reporting, we often at the end sometimes put a line like, if you know a similar intervention, or if you know an intervention that's supporting a community or whatever, let us know. So we're almost like putting it out to them to also share with us similar structures. So the call to action really is the way we ask them to engage with us and respond. And ultimately, when you have that feedback, then us as an organization, we're able to respond back and have a conversation with people who show interest in the reporting that we're sharing.
Yeah, it's quite true. Then, do you think a paywall can work for solutions journalism? Sorry, do you think a paywall model would work?
I think a paywall can be tricky, but I wouldn't rule it out. A paywall, as I said, is being used by many large news houses, and the reason why a paywall could work is if you have a loyal community that's around you, and if you're able to write content that people have a continued interest in, and the paywall, as I said before, restricts you to potentially maybe 2-3 stories a week, or let's say a month. And once you exhaust that, and if you want more, are you willing to pay for it? I know, for instance, in Nigeria, Business Day does that. But then again, Business Day produces daily business news. So the content you're providing has to be something that people want to keep on coming back for. And I think when you hit onto a news item people keep on coming back for, then you get a larger sense. So then it's a bit more realistic to say, yes, we can apply a paywall because people are willing to pay for our content. Otherwise, it very much is the case that the role of your solutions-oriented pieces is more to influence or to support in the implementation of solutions. And in that way, by making it free, make it more accessible, because ultimately in sharing those solutions, there isn't a profit motive, which, I won't say a paywall has a profit motive, but paywall often has a cost motive, in that to be able to fund your stories, the paywall is the funding from the paywall is what supports your ability to produce those stories.
Okay, thank you. So, Chidera, I would like to know, what's the advice for a startup that is exploring solutions journalism?
I might say the first thing is to ensure that when you are starting up, your reason for doing it is you want to be focused on providing answers to social problems in any sector that you particularly work in. And that has to be your North Star, that you want to be able to report on solutions. Why do you want to do it? You want to do it to be able to provide empowerment or hope that not all problems are insurmountable. So your starting point is really deciding that that's what you want to do and why you want to do it. The next stage is thinking how you're going to fund it. Are you going to be able to go into communities, or whether towns or rural areas, cities, wherever, to report on the news? Are you able to sustainably do this? And also, when you're doing the articles, you want to produce quality stories. And quality stories means, how are you going to share that? Are you going to share it on your platform? Are you going to share it on WhatsApp? Are you going to share it on social media? Because these are platforms that are free, so that's easy to do. Of course, if you're going to go down the print route, then you're looking at print costs, distribution, et cetera, et cetera, et cetera. So you're looking at a model that you can afford, you can sustain, and who do you want to target, who do you want to reach? Social media is all enabling. It enables you to reach a very broad audience at a significantly lower cost than, for instance, print journalism. But of course, you're up against the print media houses who already probably have an established following and have reputation and are well known. So there's already that brand recognition within them. I think, as I said, the starting point is really deciding why you want to do it, thinking clearly about the funding of it, and thinking ultimately of how you're going to distribute your content.
So I think there's no question, the comment that I would like to read to you regarding the paywall thing. Maybe your thoughts on it. Irene writes, from my observation, it appears the paywall isn't quite feasible in Africa. Many believe news is free as they've always had it, and this remains a challenge for news organizations. So maybe if I would take you out of solutions journalism and Nigeria Heritage, but I know you don't have this kind of problem. Do you think there is possible in the short or long term for African media organizations to overcome true independence and still be financially sustainable?
I think, looking at news houses, let's say, for instance, in Nigeria, from your Guardians to your This Day, etc. I mean, they have a model which helps them to be sustainable. And what they do is through advertising. And that's how many media houses, print houses are sustaining themselves, and that's through advertising. And how do you even get that advertising revenue? You have to build a trusted brand that people know and people are willing to spend money on buying with it, newspapers, etc. Now, I think the challenge we have in African countries, and I think in the UK and the US and globally, it's the same situation whereby people are accessing news for free on Twitter, Facebook, etc. So why would you pay for it? Through a newspaper. You buy a newspaper in the morning. In the afternoon, there could be a breaking news item, but that news item is not reported in the newspaper. Whereas you can go on Twitter, or you can go on Facebook or Instagram, or even on some of these big media houses, BBC, etc., and they have breaking news. So those are more up to date. So I think globally, most media houses are very, very much challenged on this issue of funding and how to ensure that they sustain their revenues. And I think it's a problem not just unique to African countries, I think it's a problem globally. How do you continue to support a media house, knowing that people are accessing news for free through social media platforms?
I agree with you. And taking it for, I think this is my whole coin too on this subject. I think as a media organization, you have to ask yourself, what is the true value that you are giving people and how do you convince them to pay for it? Why would somebody want to pay for your product? Why would they need to pay for your solution? There are different streams of it. I used to tell myself that I wouldn't pay for some subscriptions, and the last time I checked, I have like 5 new subscription service that I have. And one of the product that I actually subscribed to recently was a newsletter that curates this amazing lady curates these lists of new opportunities for journalists, and it's very reliable. So the money was not too much. So I actually, because I needed that information, I needed those details, I had to pay for that subscription. So my advice for you is also know that, ask yourself, what can you be the only one that can provide this that you think people would pay? And so that should be something that and there are lots of models already. Like you rightly mentioned, we have news organizations that will just give you 2 lines, and you have to go behind the paywall to be able to do it. And many we've seen is a global trend. We've seen lots of media organizations globally doing it. Even we also have some products in the African continent that are also based on that approach. And so let's take this conversation beyond money and look at what still needs to be done. One conversation I heard that somebody, I was speaking to a journalist and I was asking her, how will you be interested in solutions journalism? The response she gave me was that there are still not enough recognition, major international recognition for solutions journalism stories. She said, and I quote, "Solutions journalism stories don't win political awards." Do you agree with this? And do you think there is still a lot to do to make that, to make journalists to be interested in making that career switch in their lives?
Okay. I think, she's quite right in that solutions journalism is not mainstream enough yet, but I do think the momentum and interest in solutions journalism has definitely increased. When we started our training of media houses and we approached editors of media houses, because ultimately, in order for a media house to even think about publishing solutions-oriented pieces, you need to get buy-in from the very top. We were very, very impressed at the interest that we received from the mainstream media houses in Nigeria. Many of the editors were quite engaged and were quite keen for their journalists to be part of the training because they identified it as something a bit newer and maybe something that would help them differentiate themselves from other news houses. So for them, there was the added advantage. And if that offers them a competitive advantage in order to get interest from people, then they were very keen to sign up. So we definitely garnered interest from them. And I think ultimately, that's how it starts, by getting mainstream media organizations interested in the practice of solutions journalism, interested in the view that this is a completely different lens through which you report on news. You're not just reporting on facts, information, but you're also providing solutions to people's problems. And if people get used to actually reading those, then people may eventually or gradually see the problems they face in their own individual communities, etc., and think through, what? I've read about this story where, for instance, they're training midwives or they're using WhatsApp to disseminate information, or, in terms of immunization, rather than mothers coming to health facilities, they're going into communities. Maybe we should actually think differently about the problem we're facing to address it. I think if we're able to build up that momentum, then the reporting on such things will become a bit more mainstream. And ultimately, as time gradually continues and momentum is built, then this will also become a standard way of reporting news. And just also to add to that, in the work that we've been doing, we actually have gathered interest from educational establishments who are also looking at modules in solutions journalism in educational establishments. So what happens going forward? If we have more interest in people at the very early stage of their careers in universities, learning the practice of solutions journalism, by the time they come out, it may even become a standard requirement for journalists to understand the practice of solutions journalism. So, these are things that have to start from somewhere. And I absolutely believe that the momentum is being built in taking this different lens to report on, on news.
Yeah, thank you very much. And I'm really, I agree with you. The momentum is actually there. But what do you think needs to change to change the perception and the mindset of the people, to ensure that, what do you think needs to happen for bad stories not to be more attractive than good stories? Is this something that can ever happen?
I think, Paul, you have to tap into people's human nature. And people are instinctively interested in negative news stories more often than positive news stories, because you will find that it almost taps into people's accepted narrative of the way life is, doom and gloom quite often. But if you have a mindset whereby you actually see life through a lens where not everything is as bad as it seems, then you're actually asking people to change their orientation and the way they see things and the way they see news and the way they assume news is supposed to be. for some people, they say, you know what, I'm not watching the news. The news is all negative. It's, depressing. I want to know. So what we end up having to do is find ways to engage people. So if we increase or institute the practice of kind of solutions-oriented, constructive-oriented journalism into mainstream news houses, the media is extremely powerful. It's a fourth, state of any country. Extremely powerful in sharing and disseminating information. If we're slowly able to seed in the practice of solutions of constructive journalism into media houses, whereby we're presenting solutions to challenges or problems, then I think very gradually the assumption wouldn't be that, all news has to be negative and people get used to only seeing that type of news. If people increasingly see news items that actually respond to social problems, then I think this can only be a good thing and changes really the way you see news reports, be it in print, radio, newspapers, whichever medium people use to gain information.
Yeah, as a wrap-up, I'd like to know what do you consider next for your organization as you explore solutions journalism further? Is that something the organization is working on? And so what is next for Nigeria Watch under your leadership?
I think for us, we started doing our solutions-oriented piece as a standalone organization on our own, but we're now part of a wider network, now training media houses and news houses. So I think going forwards, in addition to just training them, what we really hope to do is be able to support them because, reporting on solutions-oriented pieces is not as easy as standard news items. For standard news items, you just go, you report on something and you walk away and that's it, you move on to the next story. A solutions-oriented piece absolutely needs a lot more time and investment in investigating, doing the research into potential solutions. So I think as an organization, if anything, I'd say is we want to be able to expand on supporting news houses, but also expanding on formats that we use to report on our solutions-oriented pieces. Because currently, as you saw from our website, lots of the work we do is, print, words focused, but we have to be able to use visuals, radio, etc., to also report on our solutions-oriented piece. So I think, if anything, I'd say is thinking critically of different formats to use, and also thinking of the audiences that we currently use, and which audience are we not speaking to with this type of reporting. So these are some of the things I think we would ultimately look at going forwards.
Yeah, before I come to you for your last remarks, I would like to also engage our participants, whether do you consider this webinar to have expanded your knowledge on solutions journalism? While that is going on, what are last remarks for our audience, and what do you think should be the key points that they should take away from today's session?
Okay. I think, something that you alluded to, Paul, which is how do we hope to take this forwards? And also the question of paywalls. I think funding in journalism is something that most news houses are looking at. So I think, if anything, there has to be a focus on building a network or community of people that read your content, ensuring that you absolutely, when you report on news, look at formats that people respond to. So you'll notice from the story you put on our website that it's very visual as well. We use photographs, we use infographics. So I think having a mixed methodology of formats helps to also create engaging content. So I think when you're producing a solutions piece, think of the ultimate person who's having to engage with your news story. Right now, I think everybody has the same issue, which is a short attention span. So I think you have to think carefully about the news that you're reporting. Is it engaging to your audience? How do you keep them coming back to read more? And ultimately, when you're reporting and using a solutions-oriented piece, are you finding solutions that people are challenged with on a daily basis? And are you providing responses that they also can identify with. So I think thinking about your content, thinking about your funding model are critical things that any organization that wants to adopt a solutions-oriented lens in their reporting needs to think about.
So we have some participants that would like to know how to get in touch with you after this. And so what I have on my mind is to share your Twitter handle. So please don't hesitate to follow. So what you have in the chat box is Vivianne's Twitter handle. And for the quick poll that we did, so I think 100% find that your session has expanded their knowledge on solutions journalism. So I really, really want to thank you for this. And one more thing that I think I would like our audience to also ask is what they think of their evolution of solutions journalism among your audience. You are the one that know your audience more. Do you think your audience will benefit from solutions journalism? And so we have a quite diverse audience from different parts of the world, so it's quite important. And I think we are seeing this need. Everybody believes that solutions journalism is what their audience needs, and it's quite obvious. And it's quite predictable. So already when we know that this is needed, it's something that we should also be intentional about advancing. So I would like to, once again, on behalf of the ICFJ, especially the Global Health Crisis Reporting Forum, I would like to thank Vivianne for making it a day with us, for being part of this session. Okay, I'm hearing that I only shared your Twitter handle with only panelists. Oh yeah, that's true. Thanks for notifying me. So yes, so that's the link. Everybody, please engage with us. She's active on social media. And so on behalf of the ICFJ Global Health Crisis Reporting Forum, I would like to once again thank you for being part of this webinar to expand their knowledge on solutions journalism. And I believe our participants have been able to learn one or two things on how they are able to actually expand their body of knowledge and integrate solutions journalism furthermore. So if you have more questions, especially everyone on this panel, I would like to encourage you to be part of the ICFJ's Global Health Crisis Reporting Forum by being part of our Facebook community. I've shared the link. We feel that place is where we actively engage one another, and we interact with each other with the goal of expanding our body of knowledge and making tools available that will help you in your journalism career, whichever stage that you have. And I will also encourage you, if you need, we have more resources available to you via the ICFJ platform. So please visit www.icfj.org to access, to learn more about International Centers for Journalism. We also have International Journalism Network, the HygiNet platform, which contains opportunities and resources that you can also access in your career. So just go to ijnet.org to be able to access a lot of resources that will help you. So until we reach you very soon again, discussing another critically important issue that is of relevance to you, I say thank you very much. Thank you, Vivianne, once again. Thank you, the entire Nigeria Health Watch team, for helping us to facilitate this. And we believe that we'll still get in touch in the nearest future to do this more again. So thank you very much, everyone, and have a lovely day.
This afternoon.